Now to the vaccine rollout. More Canadians are getting a shot in the arm.
Take a deep breath in. You're going to blow it out.
This is Nova Scotia's first person to get vaccinated. Danielle Sheaves is a registered nurse. She works in a COVID unit at a Halifax area hospital. She was one of about 390 Nova Scotia healthcare workers to be vaccinated today.
I was honored to be asked to be the first person to get the vaccine this morning. I think this is one of the only ways that we're going to get back to some semblance of a normal life, and will protect the public, our patients, everybody. So I think everyone should get the vaccine.
Rollout of the Pfizer-BioNTech vaccine is now underway in nearly every province in Canada. Along with Nova Scotia, PEI, Newfoundland and Labrador, and Manitoba also administered their first shots today. New Brunswick is expected to begin rollout this weekend. The territories are waiting for approval of the Moderna vaccine, which is easier to transport. In Ontario, vaccinations are ramping up for priority groups, but it's too late for people getting sick now. Public health officials warn the situation remains extremely volatile. More than 2,000 new cases were reported in Ontario today for the second day in a row. 43 more Ontarians have died. That pushed the province past a grim new milestone. More than 4,000 people in Ontario have now died of COVID-19. Hospitalizations are climbing too. 932 people are in the hospital in Ontario, 256 of them in ICU. Toronto Public Health says the restrictions are not working to stop the spread and more needs to be done. Ontario hospitals already over capacity are being told to activate emergency plans to clear beds for a surge in more COVID-19 patients. Abigail Bimman reports.
The message to the public is the same as it would have been, just even louder, to say that there's real strain on the system.
At Toronto's Humber River Hospital, COVID-19 patients fill close to half of the ICU. Bracing for a further surge, they're making space however they can.
In the acute care centre, also looking at unconventional spaces to surge into.
This memo from Ontario Health to all hospital CEOs in the province calls for those in the hardest hit areas, grey and red levels, to ensure at least 10 to 15% surge capacity for COVID-19 patients within 48 hours. The rest of the province is asked to plan for the same thing.
We've adopted this dimmer switch model. So we want to dim down elective procedures and surgeries and other kinds of care that can safely be deferred, not canceled, but deferred, but do as much of that work as we possibly can.
At St. Joseph's Healthcare in Hamilton, they're still deciding whether to defer elective and non-urgent surgeries, but they're confident they can hit the 15% bed increase target, in part through a satellite site set up at a hotel.
By the end of the day tomorrow, 30 additional patients will have been moved, so that will be very helpful. We also have a natural slowdown of surgical volumes over the Christmas break.
A Christmas slowdown is common across the board, but so is the fear about what will happen in January.
Unless we behave during the holidays, we are going to crumble the system, and the 10 and 15% of the beds will not even help.
Many hospitals are asking staff to consider canceling vacations over the coming weeks. Meanwhile, the Ontario Hospital Association held an emergency board meeting to discuss the potential surge in hospitalizations. The group calls it a, quote, far more serious situation than the first wave, but declined multiple interview requests to discuss the state of things. Abigail Bimman, Global News, Ottawa.